Today I am going to discuss regarding incidence, prevalence and levels of prevention. So the first is incidence. So the definition of incidence, it is defined as the number of new cases occurring in a defined population during a specified period of time. So incidence means it defines the number of new cases occurring in a defined population during a specified period of time. So here the new persons who are affected by the disease in a specific time period are goes under incidence. So incidence measures the rate in which new cases are occurring in a population. It is not influenced by the duration of the disease. So incidence basically count the new cases, means the population who are affected by the disease the first time in a specific time period is called incidence. There are a formula is present. There is a formula that is we can calculate the incidence rate through this formula, that is the new cases in defined population in specific time period is divided by total population at risk over a specific period of time multiply with 100. So by this formula we can calculate the incidence rate. So as for example, if there had been 100 new cases of an illness, if in a population of 1000 in a year, the incidence rate would be 100. So from this example, if there had been 100 new cases and if the population is 1000 in a year, the incidence rate would be the risk population. If the risk population is 1000 in a year, the incidence rate would be 100 divided by 1000 into multiply with 100. So it is about 10%. So by this formula we can calculate the incidence rate. So from the definition incidence, it means the incidence refers only the new cases. The second point is during a given or a specific time period and in a specified population or population at risk. So from the definition we can get the term incidence by these terms, that is only new cases, and second is during a given period, third is in a specified population or population at risk. So the incidence means it mainly focuses on the new cases occurring in a defined population in a specific time period. So here the time period is specific, the population is specific and the new cases. So these three terms we can get from incidence, the definition of incidence. So the prevalence mainly measures the pre-existing cases of disease and new cases, means prevalence identifies the total population who are affected by the disease, means the new cases as well as the old cases, pre-existing cases besides this the new cases. So overall population who are affected by the disease are counted under prevalence. So prevalence means it refers to the proportion of person in a population who have a particular disease at a specific or specified time period. So from this picture you can understand betterly, that is what is incidence and what is prevalence. The incidence is the new cases and the prevalence is the new cases and as well as pre-existing cases. So Means the new cases and the pre-existing cases are called total population who are affected by the disease. Those are categorized under prevalence, and the incidence categorizes the only the new cases. So from that picture you can understand the what is incidence and what is prevalence. So next is the levels of prevention. The goals of prevention are to promote health, to preserve health, and to restore health when it is impaired, and to minimize the suffering and distress. So the main goal of prevention is to promote health, preserve health, and restore health. And the main function is to minimize or reduce the discomfort, distress, or suffering or health problem. So the main objective of preventive medicine is to oppose the cause or reason of the disease. So the main aim or objective of the medicine is to defense against any disease. There are four types of prevention are present. First is primordial prevention. The primordial prevention refers to avoiding the development of risk factors in the first place. The primordial prevention is defined as preventing the risk factors. So mainly from the primordial prevention, it mainly focuses on the preventing the development of risk factors. Means it categorizes the population who are healthy at present but can develop the disease or can develop the risk factor in future. Develop the risk factor in future. So the primordial prevention mainly focuses on the preventing the development of risk factors. So the main intervention in primordial prevention, that is individual and mass education. For example, in primordial prevention, efforts are directed towards discouraging children from adopting harmful lifestyle. So it means it is the attempt to prevent the occurrence of risk factors. Like in hypertension or diabetes, the primordial prevention helps to prevent the occurrence of risk factors of hypertension or diabetes. Next is the primary prevention. The next type is primary prevention. It is defined as action taken prior to the onset of disease, which removes the possibility that a disease will ever occur. So it means from the definition, it says action taken prior to the onset of disease, means in primary prevention where the disease are not take place but the risk factors are present. So here here the disease are prevented. Main aim is the disease are going to be prevented but risk factors are present. But in primordial prevention they are already there, the person is completely healthy but in future the person can develop the risk factor. So here that in primordial prevention the risk factors development are prevented. The development of risk factor is prevented through primordial prevention. But in primary prevention where the already risk factor are present, the action are taken to prevent the disease. It signifies intervention in the pre-pathogenesis phase of the disease or health problem. So primary prevention is about treating risk factors to prevent the disease. Here I already told that in primary prevention the risk factors are already present but we take the step, that is primary prevention, to prevent the disease and treat the risk factor. Because I told that in primary prevention risk factor are present, so we treat the risk factor, that why the disease cannot be happened. As for example, in case of hypertension the primary prevention is to treat the risk factors of hypertension like obesity, dietary pattern, lifestyle. So the risk factors of hypertension are those dietary pattern, lifestyle, obesity. So in this case we in primary prevention we treat the risk factors, that is obesity, lifestyle, dietary pattern. That's why in future the disease cannot be occur, will not occur. Next, the secondary prevention. It can be defined as action which halts the progress of a disease at its early stage and prevents complication. So in secondary prevention, from the definition, it says that action which halts the progress of a disease, means in secondary prevention, by the intervention we halt or we stop the progress of a disease, further progress of a disease. That's why it is the early stage of disease and we prevent the complication. So in secondary prevention, the interventions are early diagnosis like screening test. So in secondary prevention here, the disease are screened at its early stage. So that's why we can hold or we can halt or we can stop the progress of a disease. As for example, identified the patients who are at early stage of hypertension. Means in stage 1 hypertension. That's why we can prevent the person or we can treat that person for further progress. So it helps to halt or stop the progress of a disease. That is secondary prevention. And last is the tertiary prevention. The tertiary prevention can be defined as all measures available to reduce or limit impairments and disabilities and minimize the suffering. So in tertiary prevention, that is here we take the measures which are available to reduce or limit the impairments or disabilities. That's why we can minimize the sufferings and so we can maintain the health. As for example, in case of last stage of cancer or the terminal stage of a particular disease, so through tertiary prevention we can minimize the disabilities or distress or impairments. So there are 4 types of levels of prevention, that is primordial prevention, primary prevention, secondary prevention and tertiary prevention. The tertiary prevention is the terminal stage or the end stage care, where we can reduce the impairments or disabilities